Hello, sir. My name is Zara. I'm going to be your provider for today.
Good night.
Okay. So we're going to be assessing the skeletal muscular system. We're going to be assessing your shoulder, elbows, and wrist. Okay. So we're going to start off. You typically, it's without a shirt to better visualize the patient's anatomy when inspecting. But the purpose of this video is going to be with the shirt on. So we're going to be inspecting the shoulders. We're going to be inspecting for any redness, joint deformity, nodules, symmetry. We're going to be inspecting the anterior portion, the bacteria major and minor, and the posterior portion. We're going to be inspecting the traps, deltoids, and rhomboids. As I mentioned, for any symmetry, deformity, swelling, nodules, muscular atrophy. Now for the joints, if you can please stand up. So we're going to evaluate the range of motion. We're going to start off, if you could please follow about the movements. We're going to start off with flexion. If you could just raise your hands up to the sky. Good. Okay, rest them to the sides. And now with your torso straight, extend them to the back. Great. So now we're gonna abduct, and we're gonna move both sides. Great. Now we're gonna adduct, and it's usually typically about 30 degrees if you go like this. Same thing in the other arm. Great. Now we're gonna rotate internally. If you could place your hands in the back like this, like if you were scratching your back. There you go. Now if you place your hands behind your neck. And put your elbows as straight as you can. Okay, that's externally rotation. If you could please take a seat. Now what I'm going to do, I'm going to palpate the shoulder. We're going to palpate both shoulders. We're going to palpate for the acromioclavicular joint, the greater of the humerus. Okay, the coracoid process. Do you have any pain or anything?
No.
We're also evaluating for any fluid in the joint. And we're going to also do the biceps groove. And now for another one, it's the subdeltoid bursa and the coracoid and the glomerular joint, which is here. And for the subdeltoid bursa, we're gonna extend a little bit. But do you have any pain?
No.
And we're gonna do the same one this side.
No.
You're unable to visualize a good one, this one, but that was for the bursa. And now for the special test, the Hawkins impingement. And this is for possible rotator cuff tear, and it's more specifically for the supraspinatus muscle. So we're going to ask the patient if put it 90 degrees. So what we're going to do is we're going to rotate internally. You let me know if you have any pain, okay?
Okay.
Any pain?
No.
Okay. So if it was a positive sign, it would possibly indicate a possible tear in the supraspinatus muscle or tendinitis. I'm sorry. And now we're gonna move on to the elbows. So for the elbows, if you could put your straight, and then we're gonna flex them. Go like this. Flex them, then extend them. Okay, great. And now if you could extend them like this. Now if you could put your palms up like this, supinate, and then palms down. Pronate. So now if you could just relax your arms. Now we're gonna same thing, inspect for redness, joint deformity, nodules, and we're also gonna palpate. There's several landmarks to the acronal process, the epicondyles, and then the ulnar groove. Do you have any pain or anything? We're also evaluating for any fluids or any warmth, redness, or anything going on. We're also going to compress lateral epicondyles for any pain. Do you have any pain?
No.
We're going to do the same process as we did for this one. to the other side, and we're gonna compare them. Okay. So now we're gonna move on to the wrist. So for the wrist, so we're gonna inspect them for any redness, swelling, joint deformity, nodules, muscular dystrophy, and then we're gonna do the range of motions. If you could flex your wrist like this. Now we're gonna extend them up. Good. Now we're gonna supinate, go like this, hands up, and pronate the palms down. Good. Now we're gonna palpate. Let me know if you have any pain on both the metatarsals, the radial metatarsal area, and the ulnar metatarsal area. Do you have any pain or anything? Now we're gonna move on to special testing for medium nerve compression, carpal tunnel syndrome, and usually if you do feel anything on these tests, you're gonna feel them from your thumb, first, second, and middle, and the half of the fourth finger. We're gonna start off with the Tinel's test. So for this one, we're gonna extend the wrist a little bit, and I'm gonna press this area. And let me know if you have any pain. No.
No.
Okay. Same thing. Extend them a little bit.
No.
No. Okay. So there was nothing for that Tinel sign, and then for the phalanx, you're gonna go like this, please, and they stay there for about 60 seconds. If you experience any pain, paresthesias there, let me know. And it's the same setting for median nerve compression. Do you have any sensation, pain, or anything? So for the purpose of this video, we're not going to wait the 60 seconds, but it was negative. And this concludes the skeletal musculature of the elbows, shoulders, and wrist. Thank you.